Have you ever looked at a horse and just, well, thought, wow, that mane looks like it's been through a blender? Or maybe, why are they rubbing their tail completely raw? It's a, it's a common thing, right? Incredibly frustrating and often really misunderstood. It affects horses all over the world, their comfort, their looks, just their overall well-being. So today, we're taking a deep dive into equine insect hypersensitivity. You probably know it better as sweet itch, or maybe some are eczema. Our mission here is to give you a really solid understanding of this condition. We're using detailed veterinary guides as our base. We want to uncover what sweet itch truly is, why it happens, how vets figure it out, and probably most importantly, the different ways you can manage it. Think of this as your shortcut, kind of, to getting informed on something that might seem pretty dense, but it's just so vital if you own or care for horses. So let's unpack this. What exactly is equine insect hypersensitivity?
Well, fundamentally, IBH is the #1 allergic skin disease in horses across the globe. It's a severe, often seasonal allergic reaction, mostly to the saliva of biting insects. Now, the main culprits, they're usually the Culicoides species, those tiny biting midges, gnats, the ones people call no-see-ums.
If those things.
Yeah, exactly. But black flies, stable flies, horse flies, even mosquitoes can trigger it too. The absolute defining feature, though, is that intense itching. We call it pruritus. It drives horses to, well, self-mutilate, causing pretty significant skin damage. If we look at the mechanics, the why, it's what we call an immune-mediated disease. Basically, the horse's immune system just completely overreacts to certain proteins in the insect's saliva. It's mainly a mix of two types of hypersensitivity. There's a type I, that's the immediate one, involving IgE antibodies and mast cells releasing histamine.
Histamine, okay, that means itching, right?
Exactly. That release causes blood vessels to widen, fluid leaks out, and you get that immediate, intense itch. But then there's also a type 5 reaction. That one's delayed, it's cell-mediated, and it leads to the more chronic inflammation you see developing over time.
Wow, okay, so it hits them twice, in a way. Now, here's something I find really interesting. The genetic side of it. It seems like some horses are just born more likely to get this.
That's definitely a big factor. We see a clear predisposition in certain breeds. You mentioned Icelandic horses. They're a classic example, especially when moved to areas with lots of Culicoides. But also Welsh ponies, Shires, some warm bloods, Friesians, Shetlands, Arabs, Connemara's, Swiss warm bloods, even quarter horses seem more susceptible.
So if you export an Icelandic horse, say, to somewhere midge-heavy.
Their risk goes way up, yeah. And here's a crucial point. Once a horse develops IBH, it's pretty much a lifelong condition.
No cure then.
No cure for the allergy itself. So management is entirely focused on preventing the clinical signs, stopping those flare-ups before they get bad. It's all about being proactive. And it's pretty widespread. The incidence, how common it is, varies a lot, maybe around 2.8% in the UK, but it can be as high as, say, 32% in parts of Australia.
Wow, that's a huge range.
It is, and in cooler places, it's usually seasonal, spring, summer, fall, when the insects are active. But in warmer climates, it can be a year-round problem. Typically, you start seeing signs when the horse is about 2 years old or older. They need that prior exposure, that sensitization to the insect saliva before the allergy really kicks in.
Okay, so we get the what, this massive immune overreaction to tiny bites. But to manage it, you really need to know the who and the where. Let's talk about the specific bugs and where they tend to bite. That gives clues, right?
Absolutely vital clues. The pattern of the skin lesions often tells you exactly which insect is the main problem because they have preferred feeding spots. So Culicoides, the midges or gnats, they're the most common cause. They're tiny, not strong flyers, and they love dusk and dawn or cloudy, still days.
Right, the worst times to be out sometimes.
Exactly. And their favorite spots. The dorsal midline, so the mane, the tail head along the back. But they'll also bite the face, ears, and underneath on the belly. And remember, they need still water or marshy ground to breed.
Okay, dorsal midline, mane, and tail. That explains the classic sweet itch look. What about others?
Then you have black flies, the Simulium species. They bite during the day. Think ears, poll, and again, the ventral midline, the belly area. And they need moving water, like streams, for their larvae.
Different environment needed there.
Right. Stable flies, Stomoxys calcitrans, also daytime biters. You'll often see bites on the legs, belly, and sides. They like breeding in decaying stuff, like old manure piles or compost.
Barn hygiene is key there then.
Definitely. Then the big ones, horseflies and deer flies. The Tabanidae, strong flyers, really painful bites, often on the neck, shoulders, legs. And finally, mosquitoes, Culicoides. They can bite pretty much anywhere, but often go for the face, ears, and ventral areas too.
So knowing where the horse is itching gives you a big hint about which fly is the main offender.
Precisely, and that directly helps you target your control strategies.
Okay, so we know it's this deep reaction, we know where the bugs bite, but let's paint a picture for someone listening. What are the absolute classic signs they'd see day to day if their horse has this? That intense itching must cause obvious problems.
Oh, absolutely. The itching behavior is obsessive. You'll see horses rubbing relentlessly on fences, trees, stall walls, anything they can find. They might bite or chew frantically at themselves or constantly stomp their feet, swish their tails excessively.
This is distressing just watching it.
It is. Initially, you might just see small bumps or wheals, like hives, where the bites occurred. Those are the primary lesions. But it's a secondary damage from all that rubbing and biting that becomes really obvious. You get severe hair loss alopecia, especially along the mane and tail. That classic rat tail or broken, rubbed-out mane look.
Yeah, I've definitely seen that.
Then you see excoriations, basically raw, scraped skin. There's
Yeah.
often crusting and scaling from the dried inflammatory fluids. And over time, with chronic rubbing, the skin can thicken and get leathery. That's called like enification. It might also darken permanently, which is hyperpigmentation.
Like permanent scarring almost?
In a way, yes. And those open sores are really vulnerable to secondary infections, bacterial ones like pyoderma or even yeast. And those infections just make the itching worse. It becomes a vicious cycle.
A nasty cycle. And you mentioned seasonality is key.
Crucial indicator. Signs usually pop up when insects are active spring, summer, early fall, and then fade in the winter in cooler climates. Though, like we said, it can be year-round in tropical areas. And often, owners report that it seems to get worse each year, each season the allergy flares up. You might also see behavioral changes, horses getting irritable, restless, generally uncomfortable.
That makes total sense. So if someone sees these signs, suspects IDH, how does a vet actually confirm it? What's the diagnostic process?
Well, often the diagnosis starts as presumptive. It's based heavily on those really characteristic clinical signs, the seasonality we just talked about, and very importantly, ruling out other things that cause itching. A strong history, this happens every summer, combined with that typical lesion pattern, like the mane and tail for Culicoides, or maybe the belly for black flies or midges, or legs for stable flies. That's highly suggestive.
Right, ruling other things out. That's a big part of skin issues, isn't it? What else could look like this?
Exactly. You need to exclude things like pinworms, they cause tail rubbing too, diagnosed with a simple PAPE test. Mites often cause intense itching, especially on the legs. You do skin scrapings for those. Lice, you can usually see them. Fungal infections like ringworm, they tend to be less itchy and have those distinct circular patches. You do a fungal culture. Then there's bacterial skin infections, contact dermatitis, maybe even a food allergy, although food allergies are less common and usually aren't seasonal, so you work through the possibilities.
Okay, that process of elimination sounds thorough. What about specific allergy testing? Does that nail the diagnosis?
It can be helpful, but it's not always straightforward. There are two main types. The first is intradermal allergy testing, or ID, sometimes called skin testing. This is generally considered the gold standard for environmental allergies. Yeah. Tiny amounts of different insect extracts, Culicoides, stable fly, black fly, etc., are injected just under the skin, usually on the neck.
And you look for a reaction.
Yeah. A positive reaction is a little swelling and redness, a wheal and flare at the injection site. But it needs specialist training to perform and interpret correctly. And recent medications like steroids or antihistamines can interfere with the results. Plus, you can get false positives. A reaction doesn't always mean clinical allergy, and false negatives too. So it's a piece of the puzzle, not the whole picture.
Okay, not definitive on its own. What about the blood tests?
Right, the serum allergy testing. This measures specific IgE antibodies in the blood. It's less invasive, no need to stop medications. However, it's generally thought to be less sensitive and less specific than the skin testing, especially for insect allergies. Part of the problem is the allergy is often to specific salivary proteins, which might not be well represented in the whole insect extracts used in the tests.
Ah, I see. So the blood test results can be tricky to interpret.
Very tricky. They aren't really considered reliable for making the initial diagnosis on their own. More like supporting evidence, maybe helpful for choosing allergens if you decide to try immunotherapy later.
Right. Okay, so diagnosis is often clinical signs, history, ruling things out, maybe supported by testing. Now, the big one. Management. Since there's no cure, what does successful management actually involve? Sounds like it has to be a multi-pronged attack.
That's exactly the word for it. Multifaceted, continuous, and requires real dedication from the owner. The main goals are reducing insect exposure and controlling the symptoms when they do flare up. And the absolute cornerstone, the most important part, is environmental management and insect control. If you reduce the bites, you reduce the reaction. Simple as that, but not always easy to do.
Makes sense. So what does that look like in practice?
Strategic stabling is a big one. Keep horses indoors during the peak biting times for the main culprit. For culicoides, that means stabling from late afternoon through early morning. For daytime flies, it might mean keeping them in during the day. Physical barriers are crucial. Lightweight, full-body fly sheets, the ones with belly bands, neck covers, tail flaps are best. Fly masks that cover the ears and maybe the nose. And using fine mesh screens on stall windows and doors.
So literally blocking the insects.
Yes, and strong fans in stalls can make a big difference against weak flyers like midges. They just can't navigate the airflow.
That's a good tip. What about repellents?
Essential, but need frequent application. Pyrethrin or permethrin-based sprays are common, often need applying twice a day, maybe more if the horse sweats. Look for ones with sunscreen. It can help them last a bit longer. There are newer options like Picardin and natural ones like citronella or eucalyptus oils, but they usually need even more frequent reapplication.
Okay, constant vigilance needed there. And the environment itself.
Absolutely. Manage the breeding sites, regular manure removal, good composting techniques to reduce stable fly breeding, eliminate standing water puddles, old tires, blocked gutters to cut down on mosquito and Culicoides breeding areas. You can also use premise sprays or foggers around the barn area, and fly traps can help reduce the adult population. Fly predators, those tiny wasps, are good for stable flies but less effective against midges.
So a whole environmental plan. Relocation is drastic, but sometimes mentioned.
It is sometimes the most effective solution. Moving the horse to an area with fewer insects, like higher altitude or a windier coastal area, but yeah, it's often just not practical for most owners.
Right, so that's preventing bites. What about treating the symptoms when they do occur? The medical side.
That's the second arm of the strategy. For acute flare-ups, when the itching is really bad, corticosteroids are usually the most effective thing to break that cycle quickly. Vets might use systemic ones like oral prednisolone or injectable dexamethasone, but always the goal is the lowest effective dose for the shortest possible time.
Because of side effects.
Exactly. There are potential risks like laminitis, especially in susceptible horses, immunosuppression, effects on insulin regulation, even gastric ulcers with long-term use. So short-term intervention is key. Topical steroids like hydrocortisone or triamcinolone creams can be really useful for localized itchy spots, giving relief without the systemic risks.
Okay, what about antihistamines? People use them for allergies all the time.
You'd think they'd be great, but honestly, horses often don't respond that well to the standard oral antihistamines we use, things like hydroxyzine or cetirizine. You might need higher doses. Efficacy really varies between horses, and they're generally not potent enough for moderate to severe itching. Plus, they can cause drowsiness in some horses.
So not a magic bullet either.
Any supplements help.
Omega-3 fatty acid supplementation is often recommended. Things like flaxseed or fish oil provide EPA and DHA, which have known anti-inflammatory effects and are generally good for skin health. But it's not a quick fix. It needs consistent, long-term use to potentially see benefits.
Right, supporting skin health over time. And topical treatments for the skin itself.
Yes, very important for soothing and healing. Soothing shampoos with oatmeal or pramoxine can help calm the itch. If there are secondary infections, medicated shampoos with chlorhexidine or ketoconazole might be needed. There are also anti-itch sprays and lotions, and antiseptic or antibiotic ointments are crucial for treating any open sores to prevent them from getting worse. Okay, that covers a lot of symptom management. I've also heard about immunotherapy, like allergy shots. Is that an option?
It is allergen-specific immunotherapy, or AIT. The idea is similar to allergy shots in people. You identify the specific insect allergens through testing, then give the horse gradually increasing doses of those allergens over time. The goal is to desensitize their immune system, make it less reactive.
Does it work?
The success rate is pretty variable, honestly. Studies show maybe 20% to 70% of horses show some improvement. It takes time, usually 6 to 12 months, before you might see a difference. And the overall long-term benefit isn't super clear from the research we have so far. It requires commitment.
So another tool in the toolbox, but maybe not a guaranteed fix. Are there newer things coming?
There's ongoing research, definitely. Things like cytokine-targeted therapies, for example, aiming at specific inflammatory molecules like interleukin-5. These look promising in early studies for other species, but they're not yet widely available or approved for horses with IBH. Still in development, really.
Okay, so a complex management plan involving environment, barriers, repellents, medical help for flare-ups, maybe immunotherapy. It's a lot. Given all that, what's the long-term outlook, the prognosis? For a horse with sweet itch, is it manageable long-term?
Well, connecting back to what we said earlier, the prognosis is generally good for managing the condition and keeping the horse comfortable. But it's poor for an actual cure. It truly is a chronic, lifelong allergy they'll have to live with.
So comfort is achievable, but the allergy remains.
Exactly, and the level of success really hinges on the owner's diligence. Strict environmental control, consistent use of barriers and repellents, prompt treatment of flare-ups, it takes a lot of effort. Without that dedicated management, the condition often does worsen as the horse gets older. You see more severe self-trauma, those chronic skin changes become more pronounced, secondary infections become more frequent, maybe even permanent scarring.
That sounds rough. Is it ever life-threatening?
Rarely life-threatening in itself, no. But severe, uncontrolled sweet itch has a huge impact on the horse's welfare. Constant discomfort, irritation. It definitely affects their quality of life. And it can certainly interfere with training, performance, even their value if someone was looking to sell the horse.
Right. And you mentioned the hereditary link earlier. What does that mean for breeding decisions?
That's an important ethical consideration. Given that there's a known genetic component and it's a lifelong condition impacting welfare, the general advice is that horses diagnosed with IBH should probably not be used for breeding.
To avoid passing on that predisposition.
Precisely.
Okay, so it's a lifelong commitment for the owner. But it sounds like, while there's no cure, it doesn't have to be a disaster sentence for the horse.
Absolutely, that's the key takeaway. With a really dedicated owner who implements a comprehensive management plan, working closely with their vet, most horses with IBH can lead comfortable, happy lives. They can often continue to be ridden, compete, or do whatever their intended job was, even if they never become completely free of symptoms. It just requires that ongoing effort and vigilance.
It really highlights the bond and the effort owners put in. So, wrapping this all up, what's the main message for someone listening today?
I think understanding equine insect hypersensitivity isn't just academic. It's about empowering you, the owner or caregiver, to make really informed decisions that directly impact your horse's comfort and daily well-being.
Yeah, turning that knowledge into practical action.
Definitely. And the fact that this condition is so common and it lasts a lifetime, it just really underscores how vital that proactive, multifaceted management approach is. It's honestly a testament to the dedication horse owners show every single day.
Well said. So, for your final thought today, something to chew on. If a bite from one tiny insect can trigger such a complex, chronic condition, one that demands this level of intense, detailed management, well, it makes you wonder, doesn't it? What other seemingly small, maybe overlooked elements in an environment might be quietly shaping the health, the comfort, the well-being of all the living things around us?